In this video, I'm going to be sharing my top tips for nursing students. Now, some of these I did not do while in nursing school, which is the reason why I am telling you right now that you need to do all these things, because it's going to be so much better for you, because nursing school is a whole different ballgame. If you're a nursing student, you probably already know how hard nursing school is. It's so different than when you were taking your prerequisite classes, and it's a lot of information in so little time. So here are my top tips. So my first tip is for you to know your learning style. Now, when you start nursing school, you're going to realize how much information you're going to have to learn in a short amount of time, and it's going to be overwhelming. So your learning style may be different than what it was while you were doing your prerequisites, and that's okay. That may happen, but get back into it and try to figure out what way you can learn best, because that's going to be a game changer while you're trying to study all that material. Don't just pass the class to pass it. You have to make sure you understand the material, so that once you're in clinicals, you can apply the information that you learned, and also so that when you start working as a nurse, you can also apply that information there. So don't just pass the class to pass it. And sometimes even that person who gets a 4.0 in nursing school doesn't really thrive in the clinical portion of nursing school. So keep that in mind. Your grades do not reflect whether you will be a good or a bad nurse. Also, make sure that you are studying a little bit at a time. It's really hard to cram all the information in the night before like I did. Don't do that. So study a little bit at a time each day so that you don't feel as overwhelmed, because I did that. I learned the hard way. Don't do that. I also want to add a quick little note in here. So my favorite study technique now that I am in grad school, I love the Pomodoro technique. I did not use that in nursing school because I didn't even know it existed 10 years ago, but that technique is amazing. So you study in increments of time. So let's say that you tell yourself, I'm going to study for 3 hours today. So you study for 25 minutes, you take a 5 to 10 minute break, you study for 25 minutes, and you take a 5 to 10 minute break, and so on until you meet your 3-hour goal. And that's been working for me as an NP student, so maybe that will help you as well. The other thing that you can do in nursing school is do a lot of test questions. So you can try that, because that's a test bank of questions that you can also do like on your free time, and that will also help you as well. Now, moving on to the clinical portion of nursing school, I highly advise to make sure that you are very proactive in clinicals. So try to immerse yourself in as many patient scenarios as you can. So if there is somebody doing like a PICC line, then go check that out. If somebody needs an IV, go do that. If somebody needs a Foley catheter, volunteer to go do it, because that's going to help you a lot, and it's going to help you not be as scared when you are a nurse working on the floor. So I really encourage you to be very proactive, because you're really in charge of your education. So as nursing students, you really have to be proactive, and you really have to put yourself out there in order for you to learn, and you cannot be scared. I know it's scary at first, because obviously it's something new and it's scary, but you have to not be scared to do things, to put in catheters, to put in IVs. And of course, not show the patient that you are scared, because then they're gonna be scared. So try to be as confident as you can, even if you've just learned it on a mannequin. Have confidence, and at the same time, remember patient safety always. So if you are not studying at all, then obviously you're not going to pass your classes, you're not going to learn. So remember, you are in charge of your own education. So put in the work. It's hard, but it's going to be worth it if this is what you really want. And just try to make the most out of every experience during nursing school and during clinicals. And most importantly, don't be afraid to ask questions. Nobody knows everything. Nobody. Like, nobody knows everything. Not even the doctors, not even the experienced nurse knows everything. And don't be afraid to ask questions. Don't be afraid to ask why they're doing a certain thing a certain way and why they're not doing it the way that you learned in the book, because you're gonna realize that sometimes you learn something in nursing school, like through the nursing school books, and then in real life it's completely different. So don't be afraid to ask that. It's okay. And just remember to make the most out of your experience during nursing school and clinicals, because it'll be all worth it. I almost forgot this very important tip, and that is self-care. I did not do that during nursing school. I completely lost myself in nursing school. So please don't do that. Take care of yourself, take care of your health, mentally, physically. I did not eat well. I gained so much weight in nursing school, and also my mental health was just horrible. It was just so much pressure that I was putting on myself, and I was experiencing so much anxiety. So please, please, please take care of yourselves. If you need a break, take that break. If you need quality time with your family, do it. I know nursing school can be very consuming, like time consuming, and even you might lose some friends during nursing school as well, but please prioritize yourself. It's so, so, so important. So anyways, I hope that you guys like this video. Make sure to like the video, subscribe, and I'll see you on the next one.